Welcome to Keep the Faith Ministry News. Just as the FDA approved the Pfizer jab for children ages 5 through 11 in the United States, medically tyrannical cities like San Francisco jumped at the opportunity to restrict the travel of children. Almost immediately after the emergency use authorization approval, San Francisco health officials announced that small children ages 5 through 11 will now have to have proof of vaccination status to get into restaurants, gyms, swimming pools, and large events like a Warriors game. Given that it wasn't even available for children to take the jab, officials stated that there will be a small grace period, but that ultimately kids will be forced to show their papers before the new year. Quote, "So that will happen no sooner than about 8 weeks after the vaccine is available to kids," said Dr. Susan Phillip of the San Francisco Public Health Department. "So there will be a limited time in which there will not be those requirements is our plan. But then at some point, 5 to 11-year-olds will also have to show proof of vaccination to access some of those same settings." Other cities like New York are now following suit with similar measures. As the Wall Street Journal points out, advocates of mandating COVID vaccines equate them with standard childhood shots against polio, chickenpox, TDAP, tetanus, diphtheria, and pertussis, and MMR, measles, mumps, and rubella. But those decades-old vaccines have gone through the full FDA testing regime. The COVID vaccine has received only emergency use authorization for this age group, meaning its safety and efficacy have not yet been established to the FDA's satisfaction. The WSJ article goes further and cites several statutes regarding the legality of such measures. In short, according to the WSJ, it is unlawful to mandate that children take these shots, yet a growing number of cities is doing just that. As TFTP reported, this push to vaccinate children is in spite of the fact that children face a near-zero threat from the virus. What's more, as Americans are quickly learning, the vaccine loses efficacy over time, leading to a large number of breakthrough cases, which has the Centers for Disease Control calling for boosters. We have zero data on the long-term effects of boosters on children. According to the recent data from the Centers for Disease Control, just 595 children under the age of 18 have died with coronavirus in the last 2 years, with nearly all of them having some debilitating underlying condition like cancer or another comorbidity. So while this new vaccine mandate for children may ease the nerves of the branch COVIDians and Team Doom, to claim that it is for the benefit of children is baseless, and given the results of a recent study, outright insidious. Research conducted by a team at the University of California has found that teenage boys are 6 times more likely to suffer from heart problems caused by the COVID-19 vaccine than to be hospitalized as a result of COVID-19 itself. Read that again. The team of researchers, led by Dr. Tracy Hoag, analyzed data reported to the Vaccine Adverse Event Reporting System, VAERS, and looked specifically at reports filed between January 1, 2021 and June 18, 2021 among adolescents ages 12 through 17 who received mRNA vaccination against COVID-19. Researchers identified 257 stratified cardiac adverse events, CAEs, within the data. As the Telegraph reports, they found that the risk of heart complications for boys aged 12 through 15 following the vaccine was 162.2 per million, which was the highest out of all the groups they looked at. Conversely, according to the study, this incidence exceeds their expected 120-day COVID-19 hospitalization rate at both moderate August 21, 2020 rates and high COVID-19 hospitalization incidence. Fast forward to this week, and Taiwan appears to be seeing the harm detailed in this study. As a result, Taiwanese health authorities have suspended the administering of second doses of the Pfizer-BioNTech COVID vaccine for children aged between 12 and 17, citing concerns about an increased risk of heart inflammation. The health authority opted to call a halt to the second jab due to concerns about an increased risk of myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the heart's outer lining. Other countries like Hong Kong and the UK have made similar moves. Even the CDC has noted reported cases of myocarditis among recipients of mRNA COVID vaccines such as Pfizer's, especially in male adolescents and young adults, and which occurred more often after the second dose. Hopefully, logic prevails and we don't end up sacrificing the health of children to have a perception of safety for the elderly. The cities will become prisons for the people of God if they remain in them. Quote, Satan will exercise his power and enmity, and oppression will be the result. The larger the city, the greater will be the oppression. Manuscript Releases, Volume 19, page 336. This is Keep the Faith Ministry News. Thank you for watching.